Hello, everyone, and welcome back to the Vet Files podcast. Today, we are incredibly honored to have a true powerhouse in our community, Dr. Jessica Stroupe. Dr. Stroupe was recently elected as the Missouri delegate to the AVMA, taking on national policy roles in public matters and finance and economics. She's a past Ortu Stella Rising Star Award winner, the 2019 Women Who Own It Entrepreneur of the Year, and a highly successful mixed animal practice owner who has made the leap from small town rural upbringing to mixed animal medicine. You probably know her best as Dr. Jessica, bringing short form videos to educate public and owners. She also has a Great Pyrenees named Harley, two cats, Leo and Cuddles, and 25 chickens. And another fun fact, she is a mom of three and runs on her lunch break every day. We are so honored to have you, Dr. Stroupe.
Thank you for having me. I'm happy to be here.
Yeah, we'd love to hear about your background. So, a lot of vet students think if they're from a suburban or small town background that they won't fit into the mixed animal niche. What sparked your passion for mixed animal practice, and how did you overcome the initial farm animal learning?
I sort of decided, I feel like later compared to most people, that I wanted to be a veterinarian. I decided about a year or less before I actually applied to vet school. So I'm from Missouri. I'm from the same town that I practice in and have practiced in since graduating vet school back in 2012. I've been out for 14 years. It's kind of wild to think about. I just turned 40. I probably shouldn't say that. But anyway, so I originally wanted to be a marine biologist. I'm from Missouri, wanted to be a marine biologist. I got a scholarship and went to college at the University of West Florida in Pensacola. They have a marine biology program. And I really enjoyed that. I loved the field work, but I learned more and more that I didn't love like kind of the research academic aspect of it. The thought of like just being in a research lab all the time and, writing grant proposals just really wasn't super appealing to me. So when I came home for the summer from college, I worked with and job shadowed my local veterinarians, which was a rural mixed animal practice. And I'm like, and just sort of fell in love with it. I loved working outside. I loved the hands on aspect of the job. I loved the relationship building aspect of the job. And I'm like, you know what? I think that's what I'm going to do. I think I'll apply to vet school. And I ended up applying to Mizzou, my home state school, which is really only about 30 miles away from where I live and practice, and got in, and the rest is history. So,
I think you're about the third vet that said they were going to do marine biology. So I want to see the pipeline. Like, what
yeah,
is
there's a pipeline from marine biology to vet med, apparently.
so we had talked about it a little bit before recording, that I'm from a small town as well, and I'm interested in mixed practice. Gretel's interested in mixed practice. Are there any rural or mixed animal myths that you want to bust?
I I do think one myth or perception is that if you're a mixed animal GP, that maybe there's some perception, not from everyone, but that you're practicing subpar medicine. And yes, there is a certain degree of you have to be very versatile and industrious, because if you go into rural mixed animal GP, there's just simply not always a specialist waiting in the wings to handle all those complicated cases for you. So we talk about spectrum of care, we talk about gold standard care. That's not always possible in these situations. And sometimes you have to make the best with the resources you have. But it doesn't mean that you're practicing bad medicine. So I think that's a common misconception. I think a lot of us are very versatile and industrious, and maybe we are a little bit more entrepreneurial, willing to take risks that others might not be willing to do. But most of us are doing our best, and we're treating animals effectively and helping clients in rural communities.
I love how you pointed out that you're more entrepreneurial because I think most people would think that small animal vets are like that because of, I don't know, the corporate world and so many
Mhm,
like people can own multiple practices at once. But could
mhm.
you talk more on that and say, like, compare like you operating your own business and things like that?
So, operating a mixed animal practice, it could certainly come with challenges. Sometimes you're in a rural area, you don't have the same client volume that you have in like a small animal urban practice. There's innate challenges with inventory management, especially on the large animal side. Managing inventory for small animal is very easy because it's a very kind of even and predictable. There's not the degree of seasonality that you have in large animal medicine. And in mixed practice, where you're carrying inventory for both companion animal and large animal, your inventory that you're carrying is very substantial. So you have to be able to handle that. You have to be able to, with the large animal side, stock up for those high volume seasons and brace yourself for those really high credit card bills when that happens too. So it's challenging. It's a totally different beast. Obviously, I've never owned a small animal exclusive practice before, but it's essentially almost like two completely different businesses, the small animal side and the large animal side.
I externed somewhere where I was talking to the vet about the business side, and it was, I
Mhm,
believe, an equine with a little bit of small animal, but mostly equine.
mhm,
And I said, "Oh, why do you not keep XYZ in stock?" And he was like, "Well, if I only grab for it once a month, then it's sitting on my, shelf going bad and wasting inventory, wasting space, wasting money, and some antibiotic that you only use for certain things." I don't know.
mhm.
The convenience of having it there for when you need it is great, but, there's cost to that as well.
Yeah, balancing the every once in a while need with, how often are you going to use it? How likely is it to outdate? That's tough. And sometimes you get expired drugs. That's just part of it too. But yeah, it's definitely challenging, the inventory management. I don't know if I have a completely perfect system yet. There's probably some people that if they looked at my books and my inventory turnover ratio, they wouldn't be super impressed. But we make it work. So,
Yeah, I think another business thing that I've always been interested in, especially in small towns, is the staffing. So I'm not asking what you pay or anything, but I've found that sometimes it can be hard to get somebody that is passionate about it and keep them for
mhm,
so long in smaller
mhm,
towns, at anywhere, not just a vet
mhm,
clinic. Is
mhm.
you had any issues with that? Have you found any tips?
I feel like my staff retention is pretty good. And, overall, yeah, we've had some cycle through, but overall a lot of people, especially my full-timers, will stay on for a period of time. And I think, there's a lot that goes into business ownership that a lot of people don't realize. And really veterinary medicine, we're treating animals, but it's really about people, especially if you're going to be a successful practice owner. It's about leadership, it's about communication, it's about building relationships. And my biggest motivation for owning a practice was, obviously I want to be my own boss, because who doesn't? Maybe some people don't. But building my culture and giving my staff the resources they need to succeed, compensating my staff the way I want them to be compensated. And I think a lot of it does when it comes to retention. Obviously, you need to be competitive, and I tell my husband all the time, I would love to pay my staff more than I actually pay them. Because I perpetually feel like, especially like support staff, or just like, I would love to pay them more. I feel like veterinary assistants, veterinary technicians, they're not compensated enough. And but sometimes it's really hard on the business side to compensate them as much as they should be, while keeping pricing the way that it should be. But all of it goes back to culture. And that doesn't mean that if you have a great culture, that means you can underpay your staff. But culture eats strategy for breakfast. I've had staff turn down much higher paying jobs because they like my work environment. They like working for my practice. So, having core values, building the culture you want, hiring slowly and firing kindly but promptly, because it's not always about who you hire, it's about who you keep in your practice. And I think so many clinics are guilty of keeping bad apples for multiple reasons, whether it's, avoiding confrontation, avoiding conversations that should have happened sooner, or just, making excuses and justifications for bad behavior. Well, you know, they stir the pot and they start a lot of drama, but they're really good at their job. So we're going to keep them on. And I feel like that's a big mistake in a lot of cases. So protecting your culture, protecting your core values, I feel like that's a very important side of staff retention.
Where did you learn how to form core values and how to lead effectively for a clinic? Because I feel like at some clinics where I've shadowed, if you put core values on the wall, they would laugh at it. And first of all, that's a red flag.
Yeah. Yeah. I'm sure when I talk about core values with my staff a lot because it really is like the center of what I do. And I would say like formulating core values was like one of the biggest moments for me as a practice owner that gave me clarity of who am I going to hire? How am I going to make decisions? How am I going to establish expectations for my staff? How am I going to evaluate them? And I did go through a whole process, and I'm not going to pretend that I invented this process. Pro Partners Wealth, you've probably heard of them. They're partners for progress with MVMA. So they kind of helped me walk through that. And how I formulated my core values was I basically listed all of the strengths of every single employee that I had. And then I narrowed it down to 4 core values because you don't want core values to be aspirational. You want them to be something that is innate, that is innately your strengths, because otherwise it's not going to feel natural. It's not going to be I don't feel like it's going to be you. So that was kind of the process I went through. And now with my core values, we talk about it in staff meetings. It's what I use to evaluate staff whenever I'm formulating interview questions for hiring. A lot of them are core values based. So it's been a really important part of my clinic. And I always compare it to, because I'm also into running and training. So it's like taking the best parts and cutting away the fat. So that's kind of how I view core values, and they've had a very positive impact on me as a leader.
Loved hearing about how you took the values of your staff and then
Mhm,
said, this is what I am implementing. Because I believe
mhm,
most people put aspirational ones, or I feel like when I read websites and every single business like has their core values listed on the front, but it's like
mhm,
the same exact words. So it almost makes it feel disingenuine. But you actually put something that's tangible and
mhm,
real
mhm,
and actually like shown throughout your clinic. Like, what are some examples? Like, if you're running your day to day practice, like Dr. Emily King, we had her on, and she told us that if something is not lining up, say you're slammed during the day, like, how do you bring people back to those core values?
mhm. I think just staying calm and kind and professional, because your more is caught than taught, and your staff feed off of your energy. And, that's hard sometimes because I'm an imperfect human. And, sometimes I need to be checked too, even though I'm the leader and I'm the one there with the most experience. But yeah, I think it's just setting a good example and, checking in with people. If you feel like someone is off, say, hey, are you okay? Or do you need to take a break? Because yeah, this job is overwhelming, and there's no way to avoid that stress and that chaos sometimes. It just happens. And, for the most part in my clinic, we have a culture of, people get lunch breaks. I don't think that it should be a standard that everyone's running around, never getting a break and eating granola bars all day. I mean, that's everyone's personal decision, but that's something that's important for me. But yeah, sometimes we work through our lunch breaks, sometimes there's chaos, and just, setting a good example for your staff and being the person that you want your staff to be.
I always am shocked at the amount of clinics that are still on. I think it's usually the ones that are much smaller staff where there's only so many people who can do the certain job. So it's like, hey, we really need you to do this, so you don't get lunch today. Or they don't say that, but the employee will feel obligated to skip their lunch, or maybe they just love their job. I've been there too. You love your job so much you want, or you're okay with skipping lunch. But I was
Mhm,
so shocked at like the clinics that still do that. And like I went to extern at one and they were like, oh, we just don't take lunch here. Like that's not a thing. And I was like, oh, well, I'll be taking lunch So, like, you don't need me here. Like, if anything, it
Yeah.
gets all a break from me. So I was like, I'll be taking lunch. Do you encourage your staff, not necessarily with the lunch thing, because that seems like an or a written rule. Do you encourage them to kind of stand up and say, hey, I think we can improve upon this or improve upon that and give
Mhm.
them a say in kind of improving the clinic itself?
Yeah, I very much value their input. And I always tell them, like, just to set expectations, I can't guarantee that everything you want is going to happen, but I can guarantee that I'm going to be open minded and I'm going to listen to your concerns and I'm going to take those into account. So, what aren't we doing that we should be doing? What should we start doing? What are we doing that we shouldn't be doing? What should we stop doing? And what is working? What should we keep doing? So, those are three common questions that I ask them all the time. And sometimes I get crickets because you know how things are when you put people on the spot. But providing opportunities for them to think about it and even write it down, provide responses anonymously. Sometimes you get better answers that way. So I very much value their input for sure.
That's amazing to hear about, like, pulling together multiple perspectives. What do you do as well with the externs? Because I feel like you have had phenomenal externs, at least I've seen from your social media.
Mentorship is a weakness of mine. I was kind of given the sink or swim form of mentorship as a new practitioner. So I feel like because of that, it's challenging for me to mentor others because I was not extensively mentored myself. Of course, my boss was it was kind of more hands off, like I'm available if you need me, but otherwise kind of do your thing. So I feel like I kind of adopted that form of mentorship, but I also realized that mentorship takes like multiple forms. And I really just try to leave students with obviously you want them to gain, technical skills and medical skills. And I feel like a lot of the students we get are students that, some have an agricultural background, some don't. And most of our externs are externing with us because they're at least interested in mixed animal practice. So kind of giving them a taste of what that looks like. Is that something that seems like could be feasible for them or for their lifestyle? And maybe they come away with it thinking, yeah, I want to do this. And maybe they come away with it thinking this isn't for me, but at least they get that clarity. So,
Yeah, and I think on the topic of externships, I don't know if anybody listening to this is gonna need to hear this, but if you are a vet and you have the option, what I'm saying is there's a lot of vets that I think take externs because they feel like they have to, or,
mhm,
maybe corporate sends somebody out and they didn't really have a say in it. I feel
mhm.
like whether it's corporate or whatever, somebody should be giving some vets some more say into whether they get one or not. Because there's some that you show up to and they do not want you there, which is fine. But now
Uh-huh.
I'm here. You know what I mean? So I don't know who needs to hear that, but just because you're a vet doesn't mean you need to take
Kaylin
me.
has had a couple bad experiences
Oh,
as
that
of
makes me so
recently.
sad for you. It makes me so sad for you. And
It's
yeah,
not
it's
their
been
fault.
like we have always had a fair amount of externs because we are 30 miles away from the University of Missouri. So we get a lot of in-state externs. I've just now sort of the past several months started to get more out-of-state externs and partially because of my social media. They find me on social media. They want to extern with me. And I've talked to my husband about this. Of course, my husband, I'm a very confident person and my husband likes to humble me, which is a good thing. It's good to bring me down a little bit. But he's like, "Why would someone look at your TikTok and be like, I want to learn from this person?"
Because you're awesome and funny and have a personality and you're
Yeah.
smart.
But
I'll be the opposite of your husband.
yeah, I feel like when I was setting up my externships, we were kind of doing it blindly. So, maybe it is odd. And I always tell people it seems weird to me sometimes. It's like people really want to come from states away to extern with me. Oh, and just because I'm on TikTok doesn't mean there aren't, veterinarians closer to them that are going to be just as good, if not better. But yeah, I think, when someone sees you on social media, they feel like they're not going in blind. They get a taste of your personality, your lifestyle, your values. So sort of makes sense. So
I was gonna say it's probably much easier to see somebody on social media and say, I'll try that out. She looks nice. Because even the
yeah.
smallest amount of insight can make such a difference because,
Mhm.
there's people, not that they're bad vets, but there's people who are not teachers. You know what I mean?
Mhm.
Or even
Mhm.
if they're not teachers, they're just not personalities that you wanna hang out with all day,
Mhm.
or
Yeah.
maybe so busy that they're locked in
Mhm.
on what they're doing.
Yeah.
Obviously, I've had some experiences, but what I'm saying
Mhm.
is, like, I can assume that people who come to you are probably like, "Oh, wow, she looks nice. That's all I need." 'Cause sometimes that's all you do need. Like,
Yeah.
as a vet, think about, like, what you would have wanted as a student, you know? And I
Uh-huh.
think some people kind of lose track of that, or
Uh-huh.
some people are just too busy to have students, and I don't know why
Uh-huh.
people force students on them. You know what I mean?
Uh-huh. Yeah.
But yeah, I think it's great that you're open to externs. I would love if everybody would love students. I love taking people under my wing, the pre-vets and
Mhm.
anybody that I can help, I love helping. So that's something that I value, but
Mhm.
I think we need more good mentors. So thank you for being willing to, you know, have people in your clinic. Um,
Yeah.
so what is your position title? It's Missouri AVMA
Delegate.
delegate. Okay.
So I'm in the House of Delegates with the AVMA. So the House of Delegates comprises two delegates from every state. And that includes U.S. territories like Puerto Rico. And so there's a delegate and there's an alternate delegate. And then there's the Allied Caucus or the Allied Organization. So and you do have to meet certain criteria to be an allied organization in the AVMA and get a vote. So, for example, AABP, AAFP, Association of Federal Veterinarians, those are all allied organizations. So, I'm Missouri's delegate. So, essentially, I represent veterinarians that are AVMA members from the state of Missouri.
There are
Mhm,
opportunities in the AVMA, PVMA, SAVMA world if you didn't
mhm,
do said organization in the previous step of your life. There's people who
mhm,
didn't do PVMA. I would say a majority of SAVMA, officers were not in PVMA or weren't at the
mhm,
level that maybe Gretel and I were, and I'm not in SAVMA. Maybe I
mhm.
skip a level and do AVMA. So
Yeah.
everybody. I think that's important to talk about. It's not like, if you didn't do this step before, you're not invited or you
Mhm,
don't have a seat at the table. So it was
mhm,
nice to hear that somebody ventured out and said, "I wanna do this." So
mhm.
what is kind of your role and what made you interested in that role? Did you get a description and you're like, that sounds good? Or did you say, I just want to do something to kind of advocate for my community and search out for that role?
I've sort of always been interested in involvement in the AVMA, and obviously, I'm heavily involved in MVMA. I was on the MVMA board before I even became AVMA delegate, and always had an interest in organized vet med. I'd say my first taste of AVMA was, I want to say it was, I forget what year, 2018 maybe. I went there as an emerging leader, and I got to sit in a session on House of Delegates, and that was very eye-opening. That whole experience was kind of a mixture of good and bad experiences. I really enjoyed the meeting because it was part of the veterinary leadership convention. A a very negative conversation. We were at a dinner and we were talking about things, and he had mentioned that, obviously this was just in 2018, a few years ago. He had mentioned that female veterinarians should be paid less. They stay at home more with their sick children, and their pregnancies are liabilities to practices. So, and I don't want to in any way paint a negative picture of AVMA because that has not been my experience in recent years, but you sort of get a picture of how things have changed over time. And instead of discouraging me from being involved, that actually encouraged me from being involved because if you're not the voice in veterinary medicine, someone else will be that voice. And, who do you want to be that voice? So that was actually a catalyst for me, not a discouragement.
So moved by that. Thank you, first off.
Mhm,
I love your perspective on. I remember when that reminds me of like choosing vet schools and thinking about Mizzou. And I love every animal under the sun. And I
mhm,
was like, oh, Mizzou doesn't have a lot of like international opportunities or exotics. And I was like, well, then why don't we form those opportunities for
mhm,
students? Like Michaela and I have worked with worldwide vets. Let's bring
mhm,
them in. Like, let's
mhm.
create those opportunities to have hopefully sustainable change. And you have done that. Also, I'm a huge feminist. So for me, I think that's why you and I got along so well during the AVMA fly in because I could also feel like your presence of we're
Mhm.
here because other
Mhm.
people will speak up when we're not. Like your
Mhm.
page, like
Mhm.
influencers trying to be vets. I'd love to hear
Mhm.
more about you combating misinformation and wanting to create sustainable change.
I've been creating content for a couple of years, but I'd say more intensively for the past year. And I didn't go on TikTok or start creation because I wanted to be an influencer. I started doing it because I wanted to show people what being a veterinarian looks like, especially being a rural mixed animal vet, what that can look like, and showing them engaging with the vet med community as well. Because I would say a lot of my followers are in the vet med community. I kind of have a mix of cattle producers, small animal people, vet med. There are other creators that engage much more with the public side, probably than I do. A lot of my content tends to be more vet med niche, but I wanted to tell my story. I wanted to show people what it's like to be a rural mixed animal vet, what that looks like. And like I said, engage with the vet med community because it's really encouraging to see others online doing their things. And that was really my motivation. And sometimes I wonder, it's like, well, I never really add up how much time I spend doing content creation, but there's times where I'm like, what are my goals exactly? What am I doing here? Is this a waste of time? But then I get a message sometimes from students saying, I saw your post or your story about being a mixed animal vet and not having an agricultural background. And it made me feel like I could do it too. And that kind of puts it all in perspective of, why I'm doing that. So,
That's amazing. Saying that you normally fit into the veterinary niche, have you had any comments where you've had to educate people or you've seen people be like confused or they saw misinformation or something that was wrong? And how do you address that as well?
most of my posts are geared like pretty positive. The post that I can think of that got the most negative comments or people kind of misinterpreting things was when it was meant to be more of a funny, snarky post about people not medicating their dog properly prior to appointments when they're supposed to do it. So people get really heated about that. So that was an example of kind of combating misinformation and why it's so important for not only the safety of the veterinary staff, but the safety of their animal as well. So that's just one specific example I can think of.
It's hard because I understand, people who forget or they didn't read the instructions correctly or whatever the scenario may
Uh-huh.
be, it's on accident. But we've
Uh-huh.
had people argue about it and say, well, I'm not
Uh-huh.
doing that and this, that. Why can't you hold him down? Specifically, I'm thinking of somebody who said, last time the drugs traumatized him, so I'd like you to hold him down. I don't know. I just didn't quite
Uh-huh.
understand the argument because I was like, you're saying the drugs traumatized him, and that may be true. I'm not discrediting that. But I think it might be worse for 4 people to hold your 90-pound dog down to trim his nails. I don't
Yeah.
I think there's a
Uh-huh.
lesser of two evils when it comes
Uh-huh.
to food meds. Like, if you're very opposed to it, I understand, but if we're recommending it, there might be a reason.
Uh-huh.
And we do it for the pet just as much as we do it for us because it is so, like, you can just tell some of the pets who have come in and have had to be, wrangled, and it's just
Uh-huh.
traumatizing for them. If you went to the
Uh-huh.
doctor and got held down by 4 people, you wouldn't
Yeah.
wanna go back, you know what I mean?
Yeah.
Like, it's just
And
upsetting to them.
people are very upset and hesitant when we want to muzzle their dogs. And I don't know if the perception is where they think that us muzzling their dogs means that we're saying that their dog is a bad dog, which is absolutely not the case. The vast majority of people in vet med understand that animals are reactive in that setting and it doesn't necessarily represent their behavior at home. But I've literally been yelled at more than once while extremely visibly pregnant for wanting to muzzle a dog that tried to bite me. So it's a common challenge with clients and education, but ultimately it's just staying calm, but setting those healthy boundaries of what risks you're willing to take and what not. And you know, they certainly have the option to not muzzle their dog, but that means that their dog isn't going to be worked on by us or treated today. So it is what it is.
Different clinics do it different ways. There's some clinics who won't even give vaccines in the room. They'll just take them to the back. Oh, we're taking him to the back. Oh, we're taking him to the back. That's fine. And then the owner doesn't see anything, and therefore you avoid all that confrontation. But I also feel like from a client perspective, it almost makes you trust your vet team more to watch them and say, I understand what's going on. So
Mhm,
companies like Veg or whatever that do, it's a
mhm,
little intimidating. Like as a vet, I wouldn't
mhm.
want to do that where they're like, come watch us do surgery. I'm like, I don't know about
Yeah,
that. But the
yeah,
concept of it, I can understand because I do think it creates kind of a better partnership between the vet and the client
mhm.
understands what you're doing a little bit more. Do you have any preferences on that?
I probably do a lot more in the room than most people. I will perform my exam and vitals, do vaccinations. I'll do blood draw for heartworm tests. Now, if I have to draw a larger amount of blood for like CBC Chem, especially in cats, but even in dogs, then I'll take them to the treatment area for that. If I'm having to clip and clean a wound, going to take them to the treatment area for that, most likely. But I do the basics in the room with people, and I think for the most part, they appreciate that. COVID years were tough because I was practicing during COVID, and my clinic was curbside for actually about a year, I would say. And I feel like that also created trust issues and anxiety in clients. And I'm not saying that curbside was a bad decision. I think it was the best thing that we could do for the situation that we were in. But, clients had a hard time with that, just having us take their animals in the building without knowing what's going on. So, yeah, I think that certain business model with Veg is obviously a successful business model, being open and being authentic. Like I said, I don't think I'd want to have a client watch me do surgery. For one, I've had way too many students pass out in the OR, so I don't want to deal with people fainting. But yeah, I will do a number of things in front of the client.
It's pretty amazing to hear. My brain always goes straight to surgeries and people fainting, and I can count probably on both my hands how many friends I've had who have fainted in an OR,
Yeah.
and they're gonna be amazing doctors, so I can't
Hmm.
even think about the general public coming in and
Hmm.
or if they think something went wrong or if something does go wrong,
Hmm.
which it does happen and most of the time
Hmm.
the vet fixes it, but
Hmm.
there can be panicked moments in surgery.
Yeah. Hmm.
And my friends have gone to some of the open concept ones and like dogs were coding. And that's, it's a traumatic experience. So my brain just
Yeah.
goes to that.
Yeah, for sure.
Mhm. So we're talking about clinic life. If we bring back to your AVMA role, so you and I were at the AVMA fly-in and we were talking
Mhm.
about the Rural Workforce Veterinary Act. I'd love to hear more about your role on the finance and economics committees and what you do.
So I actually just joined that committee at the last meeting. I'm very interested in that, not only as a practice owner, but just in general. And I think it's a great committee to be on as far as something that's really important in vet med. Obviously student debt is a huge issue. Rising overhead costs with clinics is a huge issue. I do feel like, especially as a rural practitioner, that students shouldn't feel like they have to go into corporate small animal medicine just to pay off their debt. Obviously, if that's what you want to do, that's great, but you shouldn't feel forced into that financially. I also think that private independent practice should remain feasible for people, and that's challenging. There's a lot of competition. Those corporate practices can buy drugs for, anywhere from 30 to 50% cheaper than what I'm buying drugs for as an independent practice owner. So, and I will say that most of the time, that doesn't mean that they're passing on those savings to the client. They're just making that much more profit. So it can be much more challenging for a small business like mine, for sure. Education loan caps, that's a big issue for students and something that is important to me as an AVMA delegate to remain a priority. So, yeah, a lot of important issues in finance and economic of the profession.
Michaelan, I wanted to bring up your cat. You were talking about the gap in the cost of pay. And Michaela and I think about this all the time with corporate.
Mhm.
We're not anti anything. We just like to
Yeah.
see both sides.
Hmm.
How do you choose like what you charge people? Because you're still
So,
paying more technically
hmm
for
hmm
your out of your own pocket. But you're probably
hmm
charging considerably less than some of the quotes Michaelan got for her cat.
Oh, for sure. And sometimes I see those quotes and I'm like, do I need to raise my prices? That's another way that the consultants I work with, Pro Partners Wealth, have been super helpful as far as pricing, because they're not saying, obviously price fixing is a big issue, and they're not saying that you have to set your prices this way. But they work with a number of vet clinics and they provide a spreadsheet for me, usually about every 6 months, on kind of averages of those vet clinics for the various services, whether it's exam fees, vaccinations, x-rays, nail trims, you name it. And, a lot of times I kind of use that as a guideline. There's some things where I'll look at it and I'll look at the average, and it is a comparison of rural practices too. It's not like I'm comparing prices to a practice in a small animal exclusive practice in New York City. Obviously, that's going to be vastly different than my pricing, but it does kind of help kind of guide me of knowing what's competitive, what I should be doing based on the volume that I'm getting. And sometimes I'll look at the average, I'll be like, yeah, that sounds okay. And I'll be like, oh, that's way too high. I'm going to charge less than that. So I know pricing, the economy's tough for people. It's challenging because a lot of clients don't understand how incredibly expensive it is to run a veterinary practice. So they come in for vaccinations and get preventatives, and they're spending, $300 to $400, especially when they're buying preventatives. And they think that you're price gouging them and you're just trying to fund your yacht or your second home in the Caribbean. And that's just simply not the case for most practice owners. If they saw my business Amex bill, they would literally poop their pants. Like it's it's tough sometimes, but it's hard to educate clients on that because they just, rightfully so. How would they know? They simply have no clue of how expensive it is.
I see a lot of it when I go external clinics and they say, oh, we don't have this thing in the system or we don't have this service. So it's generally just like, what do you want to charge kind of thing? What do you want it in the system as? Because we've never done it before. So,
Mm-hmm.
like an excessive handling fee I saw one time because it was warranted. It was warranted.
Mm-hmm. Yeah.
And we were like, no, I don't know, throw $20 on there. And some people
Mm-hmm.
wouldn't even charge extra, and some people would charge much more than that because of what we
Mm-hmm.
had done. And I've also seen, as far as drugs, like I know one place said they didn't have a certain drug that they'd order special for somebody. And they said, well, we just do price times 50%. So 150%. If it was a $100 bottle of whatever, then they charge 150 and the company profits 50. So
Mm-hmm.
that's something that I found interesting because I was like, who even came up with that? And I don't
Mm-hmm.
like, and that's
Yeah.
like a big number. You're profiting $50 for selling me drugs. Well, most bottles of drugs aren't $100. It depends on what it is. But
Mm-hmm.
if you had a $20 bottle of medicine and they're making $10, I don't know.
Mm-hmm.
But
Yeah.
yeah, for reference, we were talking about a surgery that my cat needs, and I was quoted 36 to 4,600 at a specialist and 150 to $600 at a private practice. And I had
Mm-hmm.
people, I just wanted to bring it back up because I had people, vet students that I was talking to that had told me when I told them that, they were like, I wouldn't even trust that. That seems so sketchy or that seems so shady. And I was like,
Mm-hmm.
well, I think that specific clinic is so high volume that they're able to
Mm-hmm.
charge a little bit less. Like every
Mm-hmm.
single clinic and every single vet is going to have different needs. And, like,
Mm-hmm.
yes, he was able to charge much less, but he
Mm-hmm.
does so many more that he was able
Mm-hmm.
to kind of balance that out. If you're not
Mm-hmm.
doing those every single day, maybe you're charging a little bit more. But
Mm-hmm.
I think it's important to highlight, like you said, you
Yeah.
can't compare cost to somebody in New York or wherever you are, some big city with higher cost of living and higher
Mm-hmm.
everything, to
Mm-hmm.
some like rural clinic that doesn't maybe have the same consideration.
Mm-hmm. And some of these older practitioners, they were able to pay for their vet school tuition with a summer job. So that's a completely different economic setup. And I think that's great for them. Obviously, they also dealt with, significantly different lower pay. And I can sort of talk about how salaries have changed dramatically since even I was a new grad. And I think it's for the good. But, those lower debt levels also allow some of those practitioners to have lower prices. So,
I do like you bringing up like the change in veterinary medicine. What have you seen? What have you seen in the last, you said you're 14 years out?
so yeah, drastic change in salaries. In 2012, when I graduated, for rural mixed animal GP, my starting salary was $55,000. And I did not get emergency compensation. That is probably one thing I should have negotiated a little more. That was just part of the salary that I made. And, whether I saw one emergency a week versus 20 emergencies a week, I got paid the same. There was no pro-sal system. And at the time, our emergency fees were actually too low. They weren't enough of a deterrent. So I was working easily 60, 70-hour weeks for $55,000 a year. I made the mistake of doing the math on how much I was making per hour, and it added up to like $19. That has changed drastically. And I think it's for the good, because a veterinarian should be making more than that, obviously, for the amount of education, your level of expertise, and the hours that you put in. And I'm not one of those people that thinks, just because I went through something, that my associates or younger graduates should go through something. Although I will say, as a practice owner, there was an adjustment phase to figuring out, as I was hiring associates, like, oh my gosh, they're asking for this, and then realizing, oh well, actually that is, kind of reasonable for what the market's doing now. But it was just a big jump. So it was tough to get used to. So that's one big change. I do see practitioners being better at setting more boundaries. And I think in some ways that's a good thing. In some ways that's a bad thing. I really salute your generation, Gen Z. You are so much better at boundaries than I ever was as an elder millennial. And I'm one of those people that I'm a hard worker, and I think as a new grad, it's sort of a balance. You need to be willing to hustle and get that caseload. There is such a thing as boundarying yourself up too much and closing yourself up to opportunities. But I do think as a new grad, if I would have set, just a few simple boundaries in place, I could have avoided a lot of burnout and a lot of stress. So that's one change that I'm seeing. You see extremes in everything. You still see people that don't set enough boundaries with their time and their clients, and ultimately that's their decision. And then you see some people that go too far the other direction, and close themselves off to learning and opportunities.
I think that there are some people who take it a little too far. You can't fire every client who says one mean comment in the room,
Mm-hmm.
but you
Yeah.
also shouldn't have to sit there and deal with everything that comes at you.
Mm-hmm.
And I had a really great conversation with the vet a while back who was like, your staff will thank you, because a lot of the times your support staff might be dealing with the more difficult clients more than you might. And I've
Mm-hmm.
experienced that even between being a vet student and being a kennel assistant or a receptionist. They're so much more likely to be rude to your support staff than they are to you. So you might not even see
Mm-hmm.
it. But if your support staff is saying, hey, this guy's doing this, hey, this guy's doing this, hey, this guy's doing this, over and over and over, every time he comes in, maybe it's time to have that conversation and say, like,
Mm-hmm.
you can't come in here and do that. Do you ever deal with that? Have you had to have that conversation?
Oh yeah, 100%. And it's kind of, everyone has to make up for themselves what they're willing to deal with and what they're not. I always said it's okay to be a little uncomfortable. It's not okay to be abused, because clients are innately difficult, and just like us, we never know what things are going on in their lives that are stressors. And to me, it's more based off of a trend. Now, there are certain things that are one-time offenses that, you're going to be gone if you come in, guns blazing and screaming and swearing at everyone. You're not going to get a second opportunity to come in. But there are certain things where, well, maybe they were just having an off day. If this isn't something that's normal behavior for them, then, you kind of give them grace in a sense. Everyone's entitled to a bad day. And if overall they, come in and act appropriately and give respect, then you kind of give them an opportunity to redeem themselves. But yeah, there's certain things that you just don't come back from as well.
There was a case where something was just giving me the vibe that this guy was just going through. You can just tell when somebody's going through something. And he had been
Mm-hmm.
difficult, but not mean. He had
Mm-hmm.
high expectations and not always very realistic expectations.
Mm-hmm.
One of those clients that's, hating on, well, this other vet did this and this other vet did this. And you're like, oh, I'm next. You know what I mean?
Mm-hmm.
That kind
Yeah,
of
yeah, exactly.
conversation.
That's always a big red flag.
Yes, yes, and you're talking to him and you're like, "I don't know, feel like I could just tell, like, something was going on," and then they had a conversation in the back and they're like, I don't want to touch it. And then we get back in and it come to find out he's like talking and he said, I just got divorced and this dog is the last thing good in my life, basically. And he was like, I'm upset that I haven't gotten the results I wanted. And I'm not saying that's an excuse to act the way that he was acting, but sometimes
Mhm.
I think we lose sight of like, hey, there might be a reason. Like, let's say, well, what made you feel this way about the situation? Not necessarily the vet. Don't go in the room and say, well, why don't you like this vet? But maybe we say, well, what could I do better? Or what do you expect of me?
Mhm.
I mean, do you have any advice on dealing with a situation like that?
Yeah, I think having a clear conversation about what expectations are. When you talk about informed consent, setting the expectations for understanding that a certain procedure is not going to cure things. This isn't the gold standard treatment, and there's disadvantages to doing this treatment. Obviously, this treatment is less expensive, which is a big plus, but that doesn't mean it's better. And having those conversations. I think clients that are able to give you clear answers on their budget, I think a lot of them are afraid to have those conversations. Talking about money can be uncomfortable for a lot of people. I don't enjoy talking about money all the time either because it I don't want it to be the center of the conversation and the main deciding factor. But the fact is, it's important for a lot of people. And at the end of the day, they still need to be able to put food on the table and support their families. So it's an important conversation to have. I'm setting those expectations around budget and around outcomes and communicating that effectively. And you can avoid a lot of conflict if you do that.
I love hearing about having conversations with people because this is just one of my fears in the veterinary world and how things are changing because we're losing a lot of private practices and we're getting
Mhm,
more like scheduled things. And obviously, that's a
mhm,
very different model than mixed
mhm.
animal practice. You could be stuck on a farm call for hours
Yeah.
with you're with the owner through their different stages of grief and
Oh, yeah.
exhaustion. I think what you're so good at is that you make people feel understood and heard and safe, and I think that that takes more than a 15-minute appointment. I
Mhm,
mean, you're building a relationship, so I don't know,
mhm,
Michaela, on your externships, like, I'm not a big fan of the quick appointments because I feel like
mhm,
the background is the most important part, and
mhm.
we're gonna lose that if we have 15-minute appointments.
Mhm. Yeah, and that's always been my business model. Everyone has a business model that works best for them. Even though I work with cattle on the small animal side, I don't want to run people through like cattle. I like to have time to have a conversation, to hear them and like I said, being an effective practitioner and practice owner, a lot of it's about communication because you can have the best surgical skills, the best medical skills, be the most brilliant doctor, but if you can't convey a diagnostic and treatment plan to a client in a way that they understand, if you don't have the communication skills to build a relationship, to show them that you care, because this is a common quote, I'm sure you've heard it, people don't care how much you know until they know how much you care. So being able to communicate that to people and build that trust is so important in being able to effectively treat their animals.
I think we could do a whole episode. I don't even know communication, getting started on that because there's so
Mhm,
many different scenarios. Like you could do
mhm,
50 episodes. You could do a whole podcast
mhm,
series on that. But one thing
mhm,
I've always noticed is like, when do you as a vet step in and say, this is my opinion? Like, I think a lot of people are getting a little touchy, especially when it comes to euthanasia and just saying
mhm,
nothing at all, whether it's
mhm,
to do it or not to do it, just kind of avoiding that conversation until the customer, the client comes to that on their own. And
mhm,
that's fine. That's one way to do it. But when you see a patient or maybe an emergency, I saw a case that it was like a heat stroke and like a 17-year-old dog that was already paralyzed before the heat
mhm,
stroke. And
mhm,
it's just one of those things where we were like in the back, like, we cannot let this dog go home because it was going to be a leave against medical advice kind of thing. And
mhm,
the client, it wasn't that they were disagreeing, they just had 0 idea, and the vet was having a hard time explaining, "This is very, very, very serious, and we either need
mhm,
to hospitalize or do XYZ, we have options, but you shouldn't leave." And the client
mhm,
was like, "Well, I don't understand, why can't I just go home and put it on a medicine?" And it was, like,
mhm,
going in circles, and then at some point, the client's about to leave with this dog, and we were like, this dog's gonna die. If it goes home, this dog's gonna die, like tonight. And at some point, the vet was like, okay, hey, I can't let you leave, like without telling you that I don't feel comfortable, without explaining to you what I think is gonna happen or what might have high chances. Do you think that
Mhm.
there's a point where you should step in? It's case by case, but
Mhm. Yeah. So they always taught us in school when a client asks, should I put my dog down or what should I do? They taught us in school not to answer that question. And I somewhat understand why they taught us that because they don't want us, putting our own values on a client because our situation could be completely different than ours. We're obviously potentially in a different financial situation, have different values around quality of life. But I'll answer that question because, in my experience, when a client is asking you, what should I do? Should I put my dog down? What they're really asking is permission and for you to say that it's okay to make that decision because they're already leaning that direction. They're asking for permission. So, I give them that if I feel like that's the best choice. And I also tell clients, I think clients are so fearful about making that decision too quickly. And so many of them have romanticized this idea of a natural death for their pet when in the reality is, natural death is suffering. I've watched all four of my grandparents die a relatively natural death, and it's terrible. It's a horrible thing. And I couldn't help but think that my patients have it so much better. And I'm not trying to get in a discussion about human euthanasia necessarily. It's just the stark contrast of it. So I'll tell clients if I think that's the best choice. Obviously, it's ultimately their decision to make, but I'll tell them what I think. And I also give them permission to make that decision. You don't have to wait till your animal completely declines to make that decision. It's okay to do it on a good day. You don't want to make that decision too soon either, but if they're declining and you want them to go out on a good day when they're still eating, when they feel good, it's okay to make that decision then as well. And sometimes in cases better to make that decision because if I'm getting a phone call at 3 in the morning to euthanize your pet because they're gasping, what happens. I'm not trying to shame people, but that means we've waited too long to make that decision.
Love that you bring that up because, in my experience, I sometimes have needed the veterinarian to back me up too. I even think,
Mhm,
and that's saying it as a vet student, like this is
mhm,
a hard decision for everyone. And even
mhm,
more so when you're a vet student, I feel like you think of every complicated thing, every single
mhm,
medication you could try. Like your pet is your science experiment. You
mhm,
try everything you can. Like Dr. Stroupe was actually with me during the fly-in, and I had a dog who was comfortable. And as soon as I left town, rapidly declined. And so I'm on the phone trying to be present for all of this, and she's there, and just being able to talk to you about it was helpful. And then coming back and having my veterinarian, and I'm like, well, what about this? And he's like, Gretel, I've worked with you. I've known this dog for 4 years. Like, he's not happy. And
mhm,
it's an emotional thing to talk about, but I think it's needed because
mhm,
sometimes we're afraid to have those hard conversations.
mhm,
But that was my friend telling me,
mhm,
and he knew my dog. And a veterinarian, you come back and you see them a few months ago, it's not that gradual, slow decline that the
mhm,
owners see. And so I
mhm,
think people forget because they're like, oh, well, they were fine a few days ago. But that's still starkly different potentially than
mhm,
months prior with a vet, and they have seen suffering in so many other ways that they can explain what that looks like. Because it's like,
mhm,
what is that, the foot in the door effect? Do you know what I'm talking
mhm.
about?
Yeah. Mhm. For sure.
But anyways, it's just very powerful, and I share that personal anecdote because I think it's important for people to hear that it's even hard for vets and vet students to make that decision because you think your brain, oh, well, we have access to everything. It doesn't make you like a superhero.
Mhm,
Still, there are limitations.
mhm.
But yeah, Michaelan, do you want to give us any cheerful questions for rapid?
we're talking about communication. I think that I would love to see, including myself, I'm talking about everybody. I think that as vets, especially people who have to have that kind of conversation, I'd love to see us have more confidence in being able to say, this is what I think, not again, case by case, it just depends, but like being able to deal with different scenarios other than euthanasia, right? And I think in school, sometimes we're taught to not do it. I think the phrase, it's up to you, or I can't make that decision is great when you use it in combination with here's the scenario from our side. Here's what you're looking at treatment wise. Here's what you're looking at if you don't treat. Here's what you're looking at comfort wise. Like, whatever the situation might be, explain, do your part. You're an expert in the field. Explain what you know, and then say, but it's up to you. I gave you both sides of each decision. Now make your choice. And I think a lot of people have veered towards not doing the explaining part and just being like, it's up to you. So I want to be better about that as a vet.
Yeah, I do feel like, and maybe the curriculum's probably changed vastly since I was a student. I do feel like that was a big navigating the whole euthanasia situation and how to perform euthanasias and how to have those conversations. And also the procedural side of it, like sedation drugs you should use, medication, how you should frame things, how you should set up the room, how you should speak with people. I feel like that really wasn't taught in school. And I think part of it is because it's such a delicate situation that having 20 students come in the room and observe that can seem kind of insensitive. So maybe that's why as a student, didn't get a huge opportunity to learn about that. But it was definitely a learning curve for me.
It's a great point that you bring up because we are not exposed to everything during school. I mean, at all. I think of the people who don't have teaching hospitals too, and that's even potentially less exposure depending on where they get distributed. So I think it's very eye-opening when you do have to just figure it out, and reaching out and maintaining a great veterinary community is really
Yeah.
important.
Yeah, yeah. The I learned a lot of things trial by fire.
So, are there any other pieces of advice that you've learned from, whether it's being a practice owner, being a vet student, being in the field, pet owner?
Ooh, that's tough. There's a lot of things. I feel for people that are interested in practice ownership, make that jump before you feel ready. If you wait until you're ready, you're never going to do it. And like in a lot of things in vet med, you learn by doing things. I really didn't know a lot about practice ownership, and I kind of compare practice ownership as you're building the plane while you're flying it, which is absolutely terrifying. But that's I've learned a lot of things in the process, and I continue to learn. I didn't become an entrepreneur because I knew a lot about business. Became an entrepreneur and a practice owner because of my willingness to learn and remain humble and be aware of what I don't know and seek advice, but be willing to learn as I go. Mixed animal practice is the same in a lot of ways. I think there are lots of mixed animal practices with, very robust mentorship programs. And if you have like a mixed practice with multiple practitioners, obviously there's more opportunity for that. But you get thrown into a lot of situations. There's lots of different species. You simply can't learn everything in vet school. So it's okay to kind of jump into those things and learn as you go if that's your only option. So yeah, lots of parallels between mixed practice and practice ownership, I'd say.
Gretel, is there anything else you wanted to touch on before we wrap up here?
You're not always ready. You just have to do it. That's the hardest part. You just have to start. And a lot of the times I feel like it's hard, but then once you got through it, you're like, oh my gosh, what else can I do?
Look what I did.
Look what I did.
I've always said if your dreams don't scare you a little bit, then you're not dreaming big enough. So
Yeah, I just had that conversation today with somebody coming into vet school. They were like, but it's not like that bad. And because I had done undergrad in 3 years, and I said, well, I'll take a gap year. Like, maybe I'm not ready yet. And then I got in and I was like, oh, wow, I'm doing this. And then you just like start running. Like, I don't
yeah.
know to explain it. And then once you have finished that first year or finished all of vet school, you're like, oh, I did that. Like,
Yeah.
it was okay. Everything's going to be okay in the end. You just have to start. You have to start somewhere. Well, usually we like to end off episodes when we remember by asking what has brought you joy today.
Oh, what's brought me joy today? That's a tough one. A lot of different things. Client relationships. We just had our county fair last week, so it didn't happen today, but I've had kids coming in to get photos with me because I bought their market steer and bring me thank you cards. That just happened yesterday. So that brings me a lot of joy, those relationships with my community and the fact that I can play a very small role in these kids' stories as far as their own journey in agriculture. Just having fun with the people I work with and enjoying coming to work. That's not to say that there aren't challenges throughout the day. Having a work environment that you enjoy being around the people is so important. And, coming home to, great kids and a wonderful family, I have a lot to be thankful for. So,
Yeah, and I so look forward. I think people forget. It even feels crazy to say, a couple years ago, Gretel and I looked up to vet students who were in vet school, and that there's always a
mhm,
step up. Vet students will look up to vets and so on and so forth, but having the power to do something such as buying the market animals, I stock showed and I've been on the opposite end, and
mhm,
it just means the world having the opportunity as a vet to do something not necessarily small, but one act that can really change somebody's day or week or month or life. There's vets who have inspired us all, and I
mhm,
look forward to having the opportunity to kind of give back in that way and say, here's something positive, and it doesn't take much, you know,
mhm,
a vet saying, "Why don't you come shadow today? I heard you're interested." Like,
mhm,
blown as a high schooler. You know what I mean? You just made that person's life, basically. I think
mhm.
vets have such a unique role in being able to do that, and I think that that's a great part of it. So thank you for contributing to whatever exhibition thing you went to because
Yeah,
they was truly such a catalyst in my journey to becoming a vet,
mhm,
and I know
mhm.
that it makes a lot of difference.
And I think I like the way you guys end this too, because, just choosing joy, choosing gratitude. I feel like there's can be a lot of negativity and vet med sometimes. The mental health is obviously a challenge sometimes. Choosing setting your mindset for the day as you're driving into work and choosing to look at the positive every single day is really important. And that doesn't mean that you ignore things that are going wrong, but you're not looking for the negative all the time. So I'd say I kind of used to be one of those people. As a new graduate, I was pretty stressed trying to learn all the mixed animal things. And I'd say the thing that changed my mindset the most was getting diagnosed with cancer at age 30. Being faced with your own mortality really kind of shifted my mindset of evaluating, what's important to me, what boundaries do I need to set? If I died tomorrow, would I be okay with the way I lived my life and the legacy that I left? And ultimately, for me in vet med, it's not about awards. It's not about owning a practice. It's not about followers on social media. It's ultimately about leaving the profession better than the way I found it. So that's important to me.
Yeah, thank you so much for sharing your story. You're one of those people that I feel vet med does not define you, or it's not the only thing about you, if that makes sense. I think it's hard to
Mhm,
get so wrapped up. It's so encompassing. And even when you do it in a good way, that you love what
mhm,
you do so much that you let it
mhm,
take over everything else. And I think you've done a
mhm.
really good job at having different aspects of your life that you're able to highlight.
Oh, thank you so much. Yeah. Hopefully I can do more and more of that on social media, and I enjoy continuing to engage with the vet med community on there. So,
I can say, as a Missourian who will be a veterinarian there, you are leaving it better than it started. And I'm just so glad that even through so much hard, you came out like even more inspired and really said, I'm going to give it my all. And
mhm.
a lot of people would do the opposite. They would crumble, but really you fought for it and continue to. So thank you so much, Dr. Stroop. Really.
I had so much fun at the fly-in with you. We did some great work while we were there, I will say. So, talked about some important issues with legislators, and we had fun too. So, yeah, I look forward to seeing you in Anaheim.
Me too.
All right. Well, thank you everybody for listening. Thank you again, Dr. Stroop, for joining us, and we'll see you next time.
Yeah, thank you so much for having me.